completely changing it, our body is not well prepared to adopt that kind of regimen. So the like people, those who take tea or coffee or any other such kind of things, some stimulants, what they can do is they can reduce the quantity in the beginning. By reducing the quantity, initially they will have some slight feeling only. By doing it for continuously 3-4 days or 1 week, now they will be adjusted to this. Again, further they can cut down and they can adopt some other healthy things. Instead of the tea or coffee, they can start taking milk or some herbal decoction. These kind of things they can add in instead of that. And slowly you will find that without any harmful effect or without any discomfort, you will be able to adapt to that wholesome pattern. Similarly, for other things also, like those who are habitual for their waking up late in night and getting up late in the morning. So that also I found some of the people, when I say that you wake up in the early morning before sunrise, they immediately complain that if I do this, the whole day I will feel very drowsy and lack of enthusiasm, these kind of things. So the thing is, slowly they have to change the pattern. They have to shift their timing. Suppose they are waking up to the 12 o'clock, 1 o'clock night, then they can shift it to the 11, then they can shift it to the 10. So slowly they will, like 10 to 5, they will be having 7 hours for good rest. So that way their health will not be affected, and by doing it gradually you will not feel any kind of discomfort. So this way we can do.
Yes, Bhaiya, very rightly said, Bhaiya. So, like we were discussing a few things last time, in maybe in continuation of if anything specific we like to discuss with Bhaiya, we can point that out also. Will that be fine, Akhilesh Bhaiya?
Ji, ji, ji. And
So,
Sundar Bhaiya will soon join and he will continue the last session which was left.
which
He
was
has to
yes,
discuss
Bhaiya,
about the home remedies and other part. So
right,
he will
Bhaiya.
continue. Till that, if any query is there or anything, uh, any participant, if they want to share their own experience of following this
Yes,
holistic health pattern, they can share it. And if they have any query, any doubt, I will try to clarify it.
Ji Bhaiya. Lata ji,
Madam. Sir, actually, this the food pattern or food that the type is it does it depend on place? For example, if we are in US, for example, we need another kind of food. My sincere doubt is whether taking liquor is bad, or is it a must for them to because it is cold there, winter, for example. Is it bad to take liquor, or is it wrong to take liquor?
Actually, taking some alcoholic drinks, okay, so that is good for health. As you told that depending upon the climatic situation, whether we can take these things or not in our routine. So actually these are recommended, but there are certain rules which one should follow when they are taking these kind of things. These specific thing in their routine, like taking some small quantity of fermented or alcoholic drinks.
Yes, sir.
Yeah. So actually it depends upon the kind of prakriti which you have and the kind of alcohol which you are taking and the food regimen which you are following and how much quantity you are taking. So these all things
Yes.
are necessary to know, and by knowing this, if you are taking it, it will give you benefit. But suppose you are just taking it thinking that because it is the cold climate and I will take some alcohol and it will be good for me, and sometimes they many of the people, they do not limit the quantity because they need a kind of mood elevation or some what do we say, the alcoholic effect on that. So they will increase the quantity, goes on taking higher quantity of this alcoholic drink. So that becomes a kind of addiction. So these things we have to limit. So the best thing is taking alcohol is it should be after the food. After food we have to take, and there are certain rules for this. Like the alcohol, we also give many of these alcoholic drinks. Like we have this draksha, sawa, ashwagandha, ristha, any other, Mrit Sanjeevani, Sura. These all are alcoholic drinks, but we give it in a very limited quantity, only 15 ml, and adding 15 ml and adding 3 times water in that, diluting it, taking it after the food. And the food which you are taking, again, you should not take milk when you are taking alcoholic drink, like like we have this kheer, etc. So such kind of things should not be combined with alcohol. So that we have to follow. And depending upon the prakriti, like the person who are of Vata prakriti, Pitta prakriti, Kaf prakriti. So actually the Pitta prakriti person, they need a kind of alcohol which is made up of sweet fruits, like from the grapes or from the kharjura. So if the alcohol is prepared from such kind of, actually there are classical names of all these alcohol, like the alcohol which is prepared from the grapes is known as draksha sava, mridvika sava. These all are there. Then the alcohol which is prepared from the kharjura, which is named as varuni. So that is good for the pitta prakriti person. For the kapha prakriti person, the alcohol which is prepared from the honey, so that is good. So that also, like honey is in the Sanskrit or in the Hindi, it is told as madhu. So madhvasava is there, one preparation. So these all are the classical, but what available in the outside is different brand that I do not know exactly from what it is prepared. So that we have to careful. And you can have benefit from this if you are following a particular kind of dietary regimen and taking. Again, the dietary regimen, it should be based on the location where you are, based on climatic situations, based on your prakriti, based on your digestive capacity. All these things you have to consider, and then you have to adopt to the healthy food pattern. So like
Sir,
a person is of, yeah, please.
no, in US they can survive without liquor. Is it possible?
Yeah. Yes, it is possible. It is very much possible. It is possible.
No.
Like
Thank you, sir.
if it is
Thank
very
you.
cold climate, even the Kashmir and other area, in the end you have very cold. Yeah. Sopanji has raised his hand.
हाँ जी गुड इवनिंग अखिलेश जी
जी भैया नमस्ते.
हाँ जी नमस्ते नमस्ते. So the same question, like sometimes even I've been observing that the people who are living in the cold regions, they give the same argument as ma'am is saying for the liquor, even for the non-vegetarian. They say they cannot survive well. It's very cold, then they have to eat the non-vegetarian food. So what is your take on that? Means they also give this logic that does it work there, or just there's a curiosity about it. I'm curious about it. Means whether it is okay.
Not necessary that someone has to compulsorily take non-vegetarian food when they are in a very cold climate. It is just because they feel it is easy to do, or we can store it for the longer time in a freezer. So that way it is considering their feasibility, it is done, but it is not like one person will not be able to be maintain his good health status without non-vegetarian. You can have even vegetarian food and you can maintain your good health.
I think again it may be a preconditioning, or now they are used to it. I think that may be also one on the taste and all. They have been now into habit of it. So that may also be the reason that they are giving the logic. So scientifically, I don't know whether it gives the warmth to the body or not, but they say that it gives warmth to the body.
Yeah.
Maybe
See,
scientifically.
all kinds of meat is not giving warmth to the body. Some certain kind of meat, mostly which are like the fish and this
Right.
all pork and other beef or this kind of meat, they have this ushna guna. They are uh, they are hot in nature, but not all kind of meats.
Right.
So actually, even even the vegetarian food, you have the many of the vegetarian food which are having the hot property, heat property, and like most of these Indian spices, okay, they are having this heat property, and they will maintain the good warmthness if you are consuming it.
Right.
Like simply this the black pepper and all, if you just add little bit in the soup, you will immediately feel very warmth. You feel clarity on your um, throat, etc. If you just put little bit one pinch itself, so that way you can maintain. So that is only that uh, based on the season, based on the climatic condition, what are the things you can add in that. So there is no compulsion that one should go for the non-vegetarian only.
Right.
Yeah.
Right. Thank you. Thank you so much. That's
Nice, Bhaiya. Bhaiya, there's one observation that I like to put forward. On
Please.
during the time I suffered from corona, uh, I got into some kind of a preconditioning that I must keep lawang in my mouth all the time. So probably throughout the day I was having, I didn't even count how many long was I chewing throughout the day.
Mhm.
I mean, if I can very, very vaguely put it forward, maybe 10 to 15 cloves a day. And then on one of the days when I was just cleaning my mouth and cleaning my tongue, so the moment I put the tongue cleaner, I found a few blood droplets coming. So, I
Yeah.
mean, immediately I could correlate through my little understanding that probably because throughout the day I was just keeping lawang in my mouth and going on chewing it throughout the
Mhm.
day. I mean, the
Mhm.
moment it will get over, immediately I'll pick another one and put it in my mouth. So could it be because of the ushna nature of it, or because the consumption was a little more than a human body can tolerate, uh,
Mhm.
or any other reason, I hardly know. So maybe I'd like to request you to let me know what actually it would have been.
Yeah, actually, what you told is very common problem, and we heard from the people like during this COVID period, lot of promotion was given for this Guduchi,
Ji bhaiya,
Giloy. Then
Giloy.
lot of promotion is given for this Trikatu. Trikatu is the combination of ginger, black pepper, and the long pepper. The combination of these three. So lot of promotion is given that one should consume this kadha of Trikatu. And I found some of the patients, those who are continuously taking this kadha, they developed even the hemorrhoids, the piles, because
Oh,
of consuming of excess of these hot things. Continuously they were taking with this kadha morning, evening, and they developed this kind of problem. Like you told about the lavanga, I found even the haridra, haldi. So much, yeah, the people started consuming healthy without knowing how much it should be taken, and they started taking a lot, like morning, evening, afternoon, like this, one spoon of turmeric, and they feel it is very safe, but they develop problems, because the thing which is very safe in a small quantity for limited time, it will become, it will create problem. Like I will just tell you the example of this ginger powder, the shunti, salt powder. Salt powder, if you take little quantity, it will be good. It will provide warmthness, it will increase appetite, and you will feel immediately relief from the cold cough. But suppose if the same ginger powder if you are taking in a large quantity, it may create the nasal bleeding.
Oh,
The
yes.
person may develop the nasal bleeding if he is consuming in a large quantity. So that kind of things may happen. So without like expert advice, we should not blindly consume something thinking that it is a herbal and I can just go on taking it. And because this COVID problem, the last it came in the summer season, April, May month.
Yes.
Already there is a very high temperature outside, 45, 46-degree temperature. And again, the people are taking this very hot drinks, warm water continuously, putting a lot of lavanga or these kind of things. So that will create problems. So like 10 to 15 lavanga in a day is a very high quantity. Actually, just 3 to 4 is more than enough. Even if you have some throat like accumulation of phlegm, etc., 3 to 4 is more than enough. It's not required of 10 to 15 of lavanga. It's very high quantity. So yeah, so there are many other options. Season wise, we can go for several options are there, like ilaichi, the cardamom. That is also very soothing to the hand. It is not very hot in nature. Similarly, like mulethi, it is also very soothing to your throat. It will remove the accumulation of kapha there, the phlegm there, but it is sweet in taste. So, like we have several other options. The only thing is when you consult to the particular person and ask for, then you will know it. Actually, these home remedies, it was there in our culture, but slowly the people, because it was not properly transferred from one generation to another generation, and slowly it is gradually the uh, right way of use of these all kitchen items that is lacking among the people. And what happened is when we heard something that this is good for health, immediately we start taking it without considering the dose, without considering how many times we have to take, when we have to take. So this is the problem.
Ji Bhaiya. And now I can see Sundar Bhaiya has also joined. So namaste, Dr. Sundaraj. Namaste, Sundar Bhaiya.
Namaste, namaste.
Yeah, namaste.
Nice.
Yeah, I'm just listening to the discussion, and Akhilesh is nicely explaining. All these spices, they are like they have this ability to rev up your digestive system, and they also help in correcting the disturbance in the digestive system, and better absorption of micronutrients present in our food will happen if you use these spices judiciously. So some food items are heavy in nature, like pulses and legumes, high in protein. Such food items will be, if you add pulses, we have this culture of tadka lagana and other things like, this helps in these spices helps our body to digest and absorb and assimilate all the nutrients in a better way if used in a right quantity. Judicious usage of pulses will help, and the same pulses, when you use them in excess quantity, they can damage the digestive system. Sometimes they can cause so many other problems also. So the dosage is very important. So For that, it should be a tradition in the house itself, where we teach our kids how to judiciously use these pulses. Just
Very
like internet, if you use it
right.
properly, it will help you in so many
Definitely.
ways.
This will be quite interesting if each one of us with right understanding can pass on the same information to the younger generation in the family.
Yes.
Very nice, Bhaiya. Another thing, Bhaiya, sometimes people develop pain in the tailbone.
Yeah.
Why does it happen and how to take care of it in the initial phase?
Yeah. See, generally people who sit for a longer duration and those who have some degeneration in the skeletal system, they might experience pain in the tailbone specifically. And people with less flesh and more bones, and this is something which we see in common. Wherever there is a pain, particularly if it is related to the skeletal system, we need to strengthen the skeletal system, and the best way to strengthen the skeletal system is regularly applying oil to the whole body and increasing the blood circulation and doing some physical activity after applying oil. And of course, to strengthen your skeletal system, one needs to nourish the skeletal system properly. There are many food items which will have more nutrients specific to skeletal system. For example, ragi, you have more calcium, it will strengthen the bones. And they also say that regularly eating till seeds also helps in strengthening the skeletal system. In fact, some people say that eating 1 spoon of till and half spoon of jeera powder mixed, chewing it and taking the whole thing inside after the proper chewing every day at least once, that will help in strengthening the skeletal system. And even the curry leaves, we call it curry leaves, are they use it as again another kind of spice for tadka lagana. उसको क्या बोलते हैं अखिलेश? Is karivepa, they say that
meaty neem.
I think so, yeah, I think so, yes. So that also helps in better absorption of calcium and other nutrients which are very useful for strengthening the bones. So exposing the body to sunlight also strengthens the skeletal system, and regular exposure increases vitamin D, and vitamin D is essential for a strong skeletal system. So there are so many ways to strengthen the skeletal system, but the best way is to apply oil and do some activity in the sun. So that should reduce the pain in the tailbone. And of course, doing asanas like Bhujangasana, Shalabhasana, Dhanurasana, all the backward bending asanas also will help in reducing the pain in the tailbone. Am I audible?
Yes, Bhaiya, you're audible.
Yeah.
Maybe we'll continue with the session as per if the participants have any other query. It will be nice because today I think probably we are resolving our queries most of the time. Yeah. Nice. So Lata ma'am, in case you would like to put forward, Parimal Gandhi ji.
Sir.
Yes.
Please go ahead, Lata.
Sir, is there any side effect for the COVID vaccine?
COVID vaccine side effects. There are some reported side effects. Hello? Can your question is there any side effect?
Audible, sir.
Okay.
Side effects.
Yes. So there are few reported side effects, but they are very, very few. Like 1 in 1 lakh, like that. We have these reported cases of side effects, but the benefits of the vaccine are far more, than the side effects of this vaccine. The thing is, if you have proper immunity, strong immunity, then people who practice good lifestyle and healthy lifestyle and right way of eating, right way of sleeping and all those things, for them, even the vaccine also will not be very disturbing. if the vaccine is entering the body, it's like a small particle of virus, dead virus, or a weakened virus is entering the body. So if your immunity is already strong, then it will not be able to disturb anything much. It will just create a memory thing to the antibodies, to the T cells, so that they will be ready whenever in future virus enters your body. It will just see that your body will be ready with enough information to handle the virus. That is the only thing which will the vaccine will do. So those people who are regularly practicing this, no, eating in time, sleeping in time, getting up in time, doing some physical activity, exposing body to the sunlight, and maintaining peace and calm inside the mind, for that practicing pranayama and dhyana, silence, and all these things, for those people already the immunity is strong. Even if they take some vaccine, that will not harm, no side effect will happen for those people. We have side effects are reported to people who are already having some complications or comorbidities, like chronic diseases, particularly lifestyle disorders. In those people only rare cases of side effects are seen. So yeah, that is the answer.
What kind of side effects have been reported?
Like, sometimes suddenly problems in the nervous system, and sometimes problems in the circulation, sometimes some sudden clots in the blood, some things. They're more like adverse reactions to the incoming virus. Suddenly, it's not just the virus, there is a vehicle which takes the virus to the body. So sometimes it is not compatible with the body. That's why I'm telling you, if the body is strong enough with proper immunity, even this vaccine with a very weak virus will not be able to do anything. It will just create an environment where your body already knows the type of attack this virus does, the mechanism of this attack, so that body will be ready with its own defense mechanism. So you need not worry about if at all you have decided to take vaccine and you have a little doubt, you just do one thing: practice dinacharya for 14 days, only 14 days, 2 weeks, a regular dinacharya. I will give you a tracker, just use it and complete all the tasks in the tracker. Then you go for vaccination, nothing will happen, no side effect will happen. Yeah. Yes, Ranganathji.
Sir, namaste, sir.
Okay, sir. Okay.
Namaste, sir. How are you, sir?
I'm fine, sir. How are you?
Sir, for the last 4 days, I've been suffering with the toothache, sir. As for your guidance, I took lavanga, sir, 2 to 3. I felt some sort of inflammation, sir, the chest, sir. Can I continue chewing that lavanga?
Inflammation in which place?
The chest, sir.
Chest.
Just below my throat, sir.
Oh, here.
Yeah.
Oh. What
Yes,
sort of inflammation? What do you mean by inflammation? Redness is there or pain?
No, nothing. Some sort of pricking, sir.
Pricking. Okay.
Yes, sir. Yes, sir. Yes, sir.
Because
yes,
of the
sir. Yes, sir. Yes, sir.
Generally, when there is a toothache, lavang is like we need to put the lavang in the caries where the hole is there.
Oh, cavity.
It is recommended that crush the lavang and put it inside the where whichever tooth is causing pain. There you need to put the thing. It's not like for eating or something like that.
Yes, grinding, sir. I'm grinding it.
Yeah. You are chewing. Yeah.
Okay. Yes, sir. Yes, sir.
That is okay, but don't take too much of lavang. Better way to reduce toothache is doing continuous oil pulling with till oil. And then triphala powder you can take, simple triphala powder. Make decoction of this triphala powder and then put it in your mouth and do gargling regularly. At least twice a day you do triphala powder gargling, and then once a day you do oil pulling. So that will also reduce the pain. Might take 2-3 days to reduce the pain, the pain to come down, but it will happen without antibiotics. You can be sure that it comes down. And the tooth powder which you use, if you can make your own kind of tooth powder, that will also help in so many ways. You can use this dalchini, long, and burnt coconut shell,
Yes.
and triphala powder.
Okay, okay, sir. I use this Listerine, sir, liquid.
Okay.
Listerine.
Yes.
Yes, sir. Thank you very much, sir. Can I take one or two? Continue. I will continue, sir.
Yes, sir. Yeah.
So I crush it into powder and put it in the cavity, sir?
Yes, yes, yes.
On the left side, my left side, sir. Only one teeth, sir.
Did I tell you this Arimedadi Thailam to do oil pulling?
No, sir. No, sir.
No?
I will.
I will just type it in the chat window.
Yes, sir. Thank you. Thank you.
This
sir.
is a medicine which specifically helps in reducing the pain. All you have to do is do, like oil pulling with this little warm oil. You take this oil.
Okay, sir.
And do oil pulling.
Available in Ayurvedic medical shops, sir?
Yes.
Okay, okay, sir.
So can you see this? Arimedadi Thailam?
Yes, sir. Yes, sir. Yes, sir.
This
yes,
is
sir.
one thing which you can use immediately.
Yes, sir. Yes.
And see, even in Patanjali shops, this churnam, this Dantadavan churnam, which is the Danta Kanti's powder, which is there, that is more effective. Because in the powder, they don't add any other agents which to stabilize and any other preservatives. It's just pure powder. So that you can use to brush your teeth.
Yeah.
Yeah, you can use triphala decoction to gargle. And also this particular oil to gargle, Arimedadi Thailam.
Good, sir. Thank you. Thanks, sir. Remaining teeth are very perfect, sir. No, only one teeth from left side. Some small cavity there.
It will come down. The pain will come down eventually. But after that, if you can regularly brush twice a day and do oil pulling in the morning after brushing the teeth regularly, just simple practice of doing oil pulling every day after brushing the teeth, that will prevent cavities and that will strengthen the teeth, and there will be no bleeding in the gums, and whole oral cavity will be taken care of just by doing oil pulling.
Yes, yes, I heard it, sir, the last time when you were with me.
Yes.
Okay, thank you very much, sir. Thank you. It's very kind of you, sir.
Yeah.
Dr. Sundaraj Bhaiya?
Yeah.
There is one question on YouTube.
Okay.
Rashmi Kulkarni ji is asking, what care is to be taken after post-COVID?
Generally, post-COVID, there are some kind of complications in elderly people. For example, post-COVID, heart becomes weak, the myocardium becomes very weak. For such people, it is very important to keep in touch with the cardiologist if they already have a heart problem. And it is very important for us to regularly check the, what we call respiratory rate and heart rate. Heart rate is very important. So sometimes it raises, it gets raised because the heart tends to become more weak, and it becomes very difficult for the heart to pump blood, and then suddenly some people get heart attack and they die. So this is one thing which everyone should be be aware of. If there is no previous heart complication, then generally it will not be there. Such effect will not be there in particularly in youngsters, but in old people already who have heart problem, then it might increase. And people with diabetes sugar levels will increase, and sometimes doctors will also prescribe insulin. But it is very important to regularly practice pranayam, and by practicing pranayam one can bring down this thing. And of course there are other complications because of COVID, like digestive system will become very weak. And of course I have seen many patients who were advised, doctors have advised them to go for lung transplantation after COVID. So post-COVID lung transplantation because of complete fibrosis of lungs. Even in such cases, with some simple Ayurveda treatments and regular breathing exercises, lung exercises and physiotherapy and counseling and pranayam, we were able to help them come out of these post-COVID complications without any transplantation or other complicated these things. And of course, other than that, there are some fungal infections which are which were prevalent in the second wave. And for that, there are some very good Ayurveda medicines which were very effective against all these fungal infections. Sometimes these fungal infections can turn fatal. So it is very important to, normally if some person gets COVID and with simple medicines it gets cured without getting admitted. After that, all we have to do is take good care of the digestive system immediately after COVID, because COVID, makes the person very weak, and people advise to eat a lot of strong strengthening food so that you will gain weight again, you will become normal. But the problem is, because sometimes because of the use of antibiotics and steroids, you might feel that appetite is more, but that is false hunger. And most of the time, within 2-3 days after eating heavy food, the digestion becomes much weaker, and sometimes complications also happen. It is very important for us to nourish ourselves properly, but it is also very important, more important, to observe our digestive system. If you eat something in the morning, by the afternoon time, if it is getting properly digested without getting the same taste of this Dakar, whatever we get belching, if it is there, then the pure Dakar is not coming, and you still feel that it's not completely digested. Still you feel like eating, but you feel like something is still there in the stomach. So you need to observe, you need to communicate with the body properly to understand if the hunger which you are getting is a false hunger or real hunger. And only if the digestive system is strong, then only you should eat food in a bigger quantity. Otherwise, slowly one should increase the quantity of food. We have seen many people getting upset, stomach upset and other digestive troubles after COVID, because they got advices from many people that you have to eat meat and very heavy food so that you will recover better from COVID or something like that. That is not the case. Don't worry about losing weight or less strength or something like that. It's very, very important to slowly increase the strength of the food after COVID, after recovery of COVID. Regular practice of pranayam and lung exercises is very important for all the people who got affected with COVID, because suddenly lungs might have some complications after recovery of the COVID also. So regular practice of lung exercises and regular exposure to sunlight, and we have prepared actually one specific health tracker for post-COVID patients. We have a program called Arogya Raksha Kavach for post-COVID patients also. So those people who are recovering, those who are still on oxygen concentrator, though after getting a discharge from the hospital, also at home they are on oxygen concentrator. For them, we have given this health tracker where all these tasks will be included, like regularly observing the breath and correcting the breath pattern, doing lung exercises, staying in hot, exposing the body to sunlight, and doing some simple walking and specific physiotherapy exercises and meditation. All these things are very important for us to recover better from COVID. So most important thing is eating in time, sleeping in time, getting up in time, and eating very, very easily digestible food. That is more important. Yeah.
I think she must have got her answer, sir.
Okay.
May I put one question?
Yes. Please.
Go ahead, Nurmali.
Yeah.
Before you joined, sir, Akhilesh Bhaiya was telling that when we are taking some asav, we should not consume milk with it or milk product with it. He named particularly like kheer, something like that. I just want to know if we are taking asav, like say simple lohasav, and we want to give the child milk also. So should it be some time gap, something like that, or you should not at all consume milk products and milk?
No, it's not like you should not at all consume. The thing is, this asav is a fermented product.
Yes.
Okay? Whether it is asav or arista, whether it is lohasav or drakshasav or the small arista or anything, it is a fermented product. So in Ayurveda, the chapter of Viruddhahara, taking any fermented product along with milk is not right. Both of them will become incompatible with each other. But maybe after 1 hour or 1.5 hours, you can have milk. if at all you want to. It's not like you should not at all drink milk while you are consuming some medicine. No, never like that.
Fine. One more query there,
Yes.
and that is, if somebody is pre-diabetic,
Okay.
can one consume mulethi?
Mulethi.
Yes.
Of course, they can consume mulethi. Mulethi is very good, and it will not increase blood sugar levels. The rasa is madhura, but it is having so many other properties. It's, whenever this product, whenever the herb is a aushadha, like there are two basic differences, basic categories. One is a ahar dravya, another one is a aushadha dravya. So ahar dravyas are some things which affect your body based on their taste, whether it is a sweet taste or salty taste or hot, spicy, or all these tastes. They have their effect on the body depending upon their taste. But there are some aushadha dravyas, irrespective of their taste, they have some special capacities like virya, guna, and other things. Those are the things which affect more. Though mulethi is sweet in nature, even if the person is pre-diabetic, they can take mulethi because mulethi is having so many wonderful properties. We give mulethi for wide range of diseases, wide range of problems. And if the doctor prescribes mulethi regularly, then you can take, or you can take it for 21 days or 45 days, like that. Just like that, you can take mulethi kshir paka to strengthen your digestive system, to strengthen your brain, nervous system. It acts on various systems. Actually, mulethi is very good for pre-diabetics. It is okay to take.
Okay. Thank you. Thank you. Yes. Manisha Di, you can
Nice. And there is one thing probably that even I like to put forward. Sometimes, like how to keep, we were talking of the nervous system itself. So it may be with the, as the age progresses, the nervous system also weakens.
Yes.
Now, what would be the best way to keep it in proper tone, like with our everyday regular schedule and regular eating habit?
Yes.
Which are the ingredients or which are the spices which need to be regularly consumed so that the nervous system is in tune, proper tune?
Yes. So, as you have pointed out rightly, there is vata prakopa in people who are above 40s and 50s. Slowly, vata domination will start happening inside our body, and this vata directly affects nervous system if it is not taken good care of. So that is something which we need to understand. Vata is the one who controls entire nervous system and all the communication part inside the body. But when vata gets vitiated, nervous system also gets disturbed, particularly when the age progresses. So it is very important for us to keep vata under check. And vata, if vitiated enough, it will trigger very fast degeneration, very fast aging process. So to reverse this aging process, to stop or slow down this regeneration also, we need to keep vata in check. Particularly nervous system is very important because the regenerative power of nervous system is very less compared to other organs of the body. That is the reason why those people who have severe damage in the nervous system, very early age, they get this disease like Alzheimer's and other diseases where the nervous system gets badly affected, and memory loss will happen, and so many other complications will happen because of the vitiated nervous system, disturbed nervous system. So what to do to strengthen nervous system? This is a good question. So every day practicing pranayam is one thing which will actually fine tune the nervous system. The second thing is regular application of oil will also strengthen the nervous system. I might have told you that recently our beloved doctor, PK Warrior of Kottakkal Ayurvedasala, he passed away after celebrating 100 years, and even the day before he passed away, he was managing the entire empire he has built. This huge chain of hospitals, particularly the super specialty hospital in Kottakkal and other hospitals, and then a very huge pharmacy, and then a big postgraduate college, all were being managed by the Dr. P.K. Warrior, who celebrated his 100th birthday in a grand way. And after that, 2 months after that, he died. But the secret behind his so strong nervous system, he says, is regular application of oil to the body every day. It seems very simple, but it is so effective. Okay, so regular application of oil to the body, and this one act will strengthen the nervous system. There are herbs like ashwagandha. Ashwagandha is wonderful in strengthening the nervous system. It calms down all the nerves, soothes them, strengthens the body, and allows us to sleep better, and reduces stress. Ashwagandha reduces stress. So that is one herb which can be taken without any doctor's prescription. It is very safe to take actually ashwagandha, at least for 45 days regularly, 1 spoon of powder with 1 glass of milk. It's very effective. Even for diabetics, it is very good. So that is one herb which we can take without any proper prescription and all. Apart from that, to strengthen the nervous system, there are some nice medicines which we can take. You were asking about spices, right? If we speak about the spices, in fact, better than spices, there are some wonderful dry fruits like acarot. Acarot is really good in strengthening the nervous system. In fact, if you look at acarot, it is in the shape of the brain. So scientific research says that it directly nourishes the brain, nourishes the nervous system. So daily 1 acarot soaked in water can be taken, along with maybe you can also take badam. Badam also is very good in nourishing the, strengthening the nervous system, soothing down the, calming down the brain. So that is something which you can take regularly. And yeah, one more important thing is we actually give a special nasal installation, nasal drops for people who with serious troubles in the nervous system, particularly people with paralysis, brain stroke and all. We put Ksheerabala 101 drops. There is one special medicine called Ksheerabala 101. 2 drops of this medicine inside each nostril every day after applying the oil before bath. That is like wonderful in strengthening the nervous system. People with the facial paralysis and all, just by putting these nasal drops, they become better. And also you just regularly you can put this Ksheerabala nasal drops, and that will strengthen the nervous system like anything. Someone is also asking which oil is better for massage. For regular usage, simple til oil, simple, very simple til oil is wonderful in strengthening the nervous system. You can heat the til oil before applying to the whole body. Heat it and apply it lukewarm. So that is something which you can do. Applying oil to both the feet before sleeping will also help in better relaxation and good sleep. So good sleep itself will take good care of the entire nervous system. And as I told you, regular pranayam also will help in strengthening the nervous system.
Nice, very nice. Thank you so much. So listening to you is always a blessing, and it is not just a food for our thoughts, but it is something that is so enriching for the awareness of our holistic health. Yes. And the small questions, the queries which each one of us put up, it not just helps the person asking the question, but the rest of the participants are equally, made aware of those aspects, and those they pay attention to those points, and then there's a lot of takeaway with each of the discussions. So with this, I think
Anisha, just a minute,
please go ahead, Manoma.
On YouTube, Sundar Bhaiya, Rashmi Kulkarni ji is thanking you. And then further she has put that, may I get the AICTE-SIP post-COVID care address?
What Kavach? Arogya Raksha Kavach.
Argos, she has written ARGOSY.
Yeah.
Argosy Kavach.
See, Arogya Raksha Kavach is a program which we are doing, in which we have a team of 30 doctors from US. And we have in our city, we have around 75 oxygen concentrators, a team of nurses, and team of Ayurveda doctors, physiotherapists, psychological counselors. We all came together to guide people who are in home quarantine suffering with this COVID, or people who got discharged from the hospital still having post-COVID complications. We are guiding them free of cost, without charging any money. So all you have to do is contact my manager, and she will enroll people in Arogya Raksha Kavach. But I think what she was asking was about the Swasthya Raksha Kashayam, which we prepare to strengthen the immune system. If you want this Swasthya Raksha Kashayam, we have made a video how to prepare this Swasthya Raksha Kashayam. All the ingredients, we have shown the ingredients and the dosage, everything, and that video is in my sister's channel. And of course, if you want to have it ready made, you can just contact again my manager. If you send the address, they will send the medicine to you, if at all it is needed. And I will just type the number of my manager. You can simply, you can just send a mail, simple mail, Dr. Sundarraj at gmail.com. You type the same in YouTube also, Dr. Sundarraj Perumal at gmail.com. So for all other information, both my manager and myself, both of us will check this mail, Dr. Sundarraj Perumal at gmail.com. So
now she has written, sir, Arogya. That means Arogya Kavach.
Yeah,
Yes.
Arogya Raksha Kavach is a program, and Swasthya Raksha Kashayam is the medicine. So if she wants the medicine, please contact Dr. Sundarraj Perumal at gmail.com. We will send you the video also, if at all you are interested in making it by yourself. Otherwise, we can send you the medicine also.
One more question in chat, and that is, which oil is applied to hair and head? Which oil be applied to hair and head?
Yeah, normally simple coconut oil will do, but if you want a specific oil which is very effective on the scalp, it is Bruhat Bringamalakatailam. Available in any Ayurveda shop to strengthen the roots and to grow hair better. So that can be done.
Okay, Manisha ji.
Nice. Nice.
You can carry further. Ji.
Good, like these 2 to 3 questions which were put forward, they too have helped the rest of us also, because this particular oil, Brihat Bringa Mulaka Telam, for hair and head, that's nice. Like I can even tell my daughter to use the same.
Yes, yes.
Thank you so much, Dr. Sundar. In fact, we wait eagerly for the Friday sessions, and all the participants who are present here, they come up with so many of their queries from their day-to-day life, and you always have something or the other to tell us from our kitchen as well, which we use in our daily life, and how we can take care of the holistic health using the same. Earlier, we were having a discussion, nice discussion with Dr. Akhilesh regarding the eating habits, and Swapan Bhaiya put up a query of whether non-veg or Lata Jeep said that consumption of liquor in the cold countries, whether it is all that a must or it can be avoided. So we very nicely discussed on the same with a lot of right understanding, and we can understand the quantity in which the alcohol consumption can be permitted into such situations, and how we can go without alcohol consumption and equally keep our body warm using some of the spices and ingredients used in our kitchen. Wonderful. And so we'll be looking forward for the next week's Friday session, and maybe we'll have something like we were talking of the spices and how you were discussing last time regarding.
Yes.
Yes.
We will continue that actually.
We'll continue with that.
I'm sorry, today I got stuck in my clinic, and luckily Akhilesh helped me. He's agreed to chip in till I come. Yeah, thank you, Akhilesh.
So, Bhaiya, normally in most of our sessions, the way each one of us work in complementarity with each other, so the things go on with a natural flow. With this, I thank you. My gratitude to you, Dr. Sundaraj, Dr. Akhilesh, and all the participants who put up questions, put up queries. That gives an answer to each one of us for very many aspects of our holistic health. With this, thank you and namaste. We'll meet again next Friday.
Thank you, Didi.
Thank you, sir.
Thank
Thank
you,
you, Dr.
Namaste.
Sundaraj. Thank you, Akhilesh ji. Namaste, everybody. Namaste.
Parikshit Bhaiya, namaste.
Is to leave the unwholesome thing and to adopt the wholesome thing is we have to do it gradually. All of a sudden, if we are cutting it down or we are completely changing it, our body is not well prepared to adopt that kind of regimen. So like people, those who take tea or coffee or any other such kind of things, some stimulants, what they can do is they can reduce the quantity